Hello friends, so today we're going to talk about why your acupuncture is not working. This is an important video for those of you who have been doing acupuncture the right way, but you truly have not. So there are times when it just won't work, but I want to address the times when it does work and why your acupuncture is not working. There are some particular cases I just will let you know we're going to briefly discuss later. Headaches, severe headaches. This woman graduated, which means 100%. Stage 4 kidney disease. This person their EGFR went to 90, which is where we want it to be. It went from 30 to 90. Acute shingles, she graduated. Low platelets, the goal was to get to 150,000, which we did. We exceeded the minimum of what was required by the hematologist. A 90-year-old woman with severe hip and sciatic pain got her to 99 and 100%. I want to share that because a 91-year-old woman or a 9-year-old child or a 59-year-old woman, it does not matter to me. I have a 90-95% success rate in helping people either significantly improve, which is 50. I consider 80 to 99%. I think most people suffering, if they know they're going to get to at least 80%, they're going to be happy. This woman graduated from severe hip pain, and she was 90. She was able to get back on her horse. Brain hemorrhage with severe migraine. She graduated, and I still treated her once in a while a few years later, and it was no longer an issue. There was no more brain hemorrhage. I have more cases. These are a variety of different kind of cases, but I want you to know when I say graduate, that means the person graduated. So why am I making this video? Someone came in. Today was his 10th treatment since December 1. Today is January 29. It is important to understand, let me make sure today is January 29. When a person says it's not working, I'm not seeing results, I'm okay if things don't work and we're doing things the right way, and then I'll just say it's not working. Surgery doesn't always work, medication doesn't always work, you try different things, but in this case, it was acupuncture has not been implemented correctly, so I had to send a reevaluation, little report to the patient so he can see what's going on and what we need to do to correct the condition, to correct the situation so we can get the desired results. Because if a person's coming in, I don't care what you're coming in for. It could be an internal condition, a musculoskeletal condition, a neurological condition, emotional mental health condition. If you're not doing acupuncture the right way, you're not going to get to 80+% improvement. And let me address this before I get to that specific case. When it's something that you can quantify, like platelets, low white blood cell counts, those kinds of things, blood pressure, blood glucose, those are things you can quantify. The EGFR, your kidney function, you can quantify those. Okay, your blood sugar used to be a 210 and now it's 97. That's not a placebo. The person did acupuncture, and the person had this condition, that was their baseline before the acupuncture. We did the treatments, and then now the person's at 97, or the blood pressure's 120 over 80, or it was 210 over 110, and now it's with medication, and now it's like 130 over 85. We're in the right direction. So those are not placebo. Those are quantifiable results. When it's something where I feel I have anxiety and I'm not able to function, I couldn't drive to work, or I had a lot of sweaty palms, those are subjective findings, but to the patient, that's all that matters. If they can't function, they feel debilitated emotionally, mentally, spiritually, whatever that means to them, and they can't get on with their days, you need to understand, both as a medical practitioner, whatever you're practicing, Western medicine, Eastern medicine, naturopathic medicine, whatever it is that you practice. I feel like this younger generation, it doesn't matter what you practice, some of you practitioners, and I say this with all due respect, considering I've been studying Chinese medicine since 1994. I've been in practice for 27 years now, since 1999. There are patients here, both civilians, I call them civilians, they have nothing to do with medicine, and people who are ER nurses, or they're medical doctors, or they're acupuncturists or chiropractors or physical therapists, and they themselves feel like when they go to their respective practitioners, their primary healthcare providers, their medical doctors, and they're asked by their doctor, what do you mean you have anxiety? What's going on with your life? You have to understand that that person is suffering, and if they can't function, if they can't get in their car, that's not just psychosomatic, just get over it. That is a severe condition. Mental health is a severe condition. So I've done all kinds of videos on each of these respective issues, mental health and the conditions I talked about earlier. What I want to share in this video is why this person's case, his case, is not working, and I hope you can understand. I did an expectations video, I did accountability video 6 times. It's how you hold my work accountable. It's a momentum video. I don't care if it has to do with fertility or diarrhea or mental health or sciatic pain. That frequency matters, and if the frequency isn't there, then we also have to discuss herbs, we have to discuss your mindset, we have to discuss your food, we have to discuss your exercise or lack of, so on and so forth. But in this case, we're going to talk specifically about why a particular condition which has to do with pain has not been working. Out of respect for the patient, I'm not going to express exactly which pain that is. It is a neurological pain. I will share that. First of all, neurological pain can be very difficult to treat, so you have to be very aggressive. You have to come within 1 to 4 days. If you're going past 4 days, just be extremely patient, or just understand you're here for, you're not going to get the immediate results that you want. You're not going to get the results you want. So the treatments were December 1, 2025. Then the next treatment was December 3. And then, so there's a 2-day difference. Then December 13, there's a 10-day difference. Not good. Then the 4th treatment was December 23, 10 days. Not good. The next one was December 27. Okay, within 4 days, that's good. December 29, within 2 days, that's good. January 3, so 29, 30, 31, 1, 2, 3, 5 days. I will push it to 5 days, but that's still not within the optimal time frame. You need to come within 1 to 4 days. Then between the 3rd to the 10th, the 7th to the 8th treatment, there was a 7-day difference. There was a 7-day wait period, not good. Then January 22, a 12-day difference, not good. Then December 22 to 29, a 7-day difference, not good. So I shared with the patient, I reshared this, I shared it at the beginning, and then I shared it after the 8th treatment. If you go under once a week, so I'm basically paraphrasing my other videos, the momentum video, the accountability videos, all 6 of them, and the expectations videos. If you go under once a week, expect marginal results. If you go once a week, I expect 30 to 70% improvement within 2 to 4 months. That means if you're going once a week, and if you want to graduate from your pain or suffering or whatever it is, and you're going once a week, I expect 30 to 70% improvement in 2 to 4 months. It is critical that we under promise and over deliver. If you're going 2 or more times a week, I expect 30 to 80% improvement in at least one thing within 2 to 6 weeks. If you're going 3 or more times a week, you're going to be better and more effective. It is better and more effective, and you're going to see faster results. My work, if you go to elementsinharmonyacupuncture.com, is all about results. That is what I have put so much pride in my work. This is my 3rd website. My first one, moveyourchi.com, we created that in 2006. After years, I tried to put all these testimonials in, and it just took too much time, but that was my first website. It's no longer there, but I have done my best to put a fraction of my work from moveyourchi.com to elementsinharmonyacupuncture.com. There are a lot of Yelp reviews online for Elements in Harmony. However, that's maybe at least 50 to 100 are missing. They dropped after how many years, because the algorithm with Yelp, if a person writes 1 or less than 10 Yelps, they disappear. And I did not always copy and paste them. It took me a while to realize that they were dropping, and I have a lot more reviews on Yelp than I do on Google. So I want to share this. If you're doing acupuncture with me or anyone else and you're not seeing the results, you need to go more frequently, okay? And I explain what to expect if you go under once a week, 2 or more times a week. The next thing I want to share is when I have a person who is going where the doctors are lowering significantly, so drastically, the mental health drugs that he's taking. And acupuncture makes him feel calm. And given the light that there are many people who go through some severe mental health issues in our country, I think it behooves us to want people to feel calm. And so if a person's been taking a mental health drug for a prolonged period of time and acupuncture makes them feel calm and they can drive and they don't feel like they're losing their marbles and they feel patient, you need to understand, based on what I just said, that if a person's coming almost every day, that is good for them until I graduate them. In this particular case, we're not even discussing graduating. We're helping this particular gentleman who happens to be in the medical world, in the Western medical world, that the faster he's reducing his medication under the guidance of his psychiatrist, we need to keep the acupuncture going. So I told him, if you broke your arm, and let's say you're a professional jiu-jitsu fighter or a boxer or a tennis player, you need your arms, or a skier, something that requires your arms. And I've treated 5 Olympians, 4 of them gold medalists. I treat, professional basketball, football players here, NFL. I've treated kids that travel around the world playing soccer. I've treated professional soccer players. I still treat professional soccer players even though they're retired now. It's my job. And these kids their path is the NFL. Their path is the NBA. Their path is playing professional baseball. They understand that when I treat them and they could not sprint and now they can sprint, they understand why. If they're going to go to practice 3 to 5 days a week and I can't say, hey, can you tell your coach to take you off practice for 2 weeks, and that's not a possibility. Maybe they can take a day or 2 off, but they understand that if we're going to be pushing that person's body, pushing that athlete's body 3 to 5 days a week. They got practice 2 to 3 times a week. They have 1 to 2 games. They need to be on top of it. They need to be able to run. They need to be able to, use their arm for tennis or golf or whatever it is they're playing. If they're competing in jiu-jitsu or wrestling this weekend, they understand that the treatment has to be aggressive. They understand that. But when it comes to mental health, it's like, well, why do you have to go more than once a week? Just, go from 100 to 50 milligrams of whatever your mental health drug is. And whether it's Prestige or Prozac or Wellbutrin or whatever that drug is, and you drop that medication and they're already feeling shaky, but this is the one thing that's making them feel calm, don't question them why it's working for them. I'm not milking them. I'm making these patients feel better during a time frame that is very critical for their healing process. So you get it, right? Like if you have elbow pain and you have to play tennis this week, and I got to get you playing tennis and you can't take off time, or if you're swimming or you're playing water polo and you're hurt, but you understand, why the person has to go 3 to 5 days a week, or maybe even more, maybe 5 to 6 days a week. If the person has, or maybe even 7 days a week for a short period of time, anywhere between a week to 4 weeks, while they're getting to that particular goal. But what people don't seem to understand is if you're suffering physically, why do you still think that they are not suffering mentally and need the medication, or they need the acupuncture treatments? So it's important to understand why frequency works. Another thing is the reason why I mentioned those particular conditions. Which ones did I mention? And these are just a few: severe headache, stage 4 kidney disease, acute shingles, low platelets, 90-year-old woman with severe hip sciatic pain, brain hemorrhage with severe migraine. And if you want, text me at 619-341-4341, and I will send you those links to those respective conditions. A patient of mine said, and he's high up there in the medical world, told his doctor that he's doing acupuncture and it's helping him. And she told him, don't do that. I'm Asian. That's what the doctor said. I'm Asian, and I grew up with this, and acupuncture is just for joint pain. Don't talk anymore, medical doctor. If you don't know what acupuncture does, I'm not going to say what your work does. Don't say what this work does. The same thing happened with the brain hemorrhage. I will say this in just a few seconds. That brain hemorrhage case, we fixed it. She had a neurologist. This was during COVID. She came in to see me February. She wrote her testimonial November 11. When she was 50% improved and she lived alone, has dogs, no husband at the time, no kids to take care of her, no parents to take care of her. She was isolating because it was a year of COVID. And so who's going to take care of her if she did the brain surgery? The neurologist said, you need to have brain surgery. She said, I don't want it. Plus, who's going to take care of me? 8 months of therapy, and I graduated her. When she was 50% better, her doctor said, stop doing acupuncture because it's just spa treatment. I went off on a video really intensely. You'd have to dig deep for this video. I went off because that is the wrong bedside manners. There are medical doctors and different nurses, people in Western medicine who are my patients. I'm not a Western doctor. I'm a doctor of acupuncture and Chinese medicine. But let me give you a master class right now on how proper bedside manner works. When something's working, don't tell them to not do it, because you have just undermined that patient's relief. If a person is suffering, who cares if it's a placebo? But in this case, it wasn't. It's not a placebo when the kidney function improves. That's not a placebo. When the blood sugar improves, that's not a placebo. When the white blood cell count improves, that's not a placebo. When a person can see that the bulging disc decrease, that's not a placebo. When a brain hemorrhage improves and it's not there anymore, that's not a placebo. These are not subjective findings. When the blood pressure goes from whatever, 200 something over 100 something to 120 over 80, that's not a placebo. These are results that you can quantify. So when someone is being told, oh, don't do acupuncture because it's just for joint pain, but they're coming here for mental health, but they're feeling better, don't dismiss them, because right now that particular who happens to be a healthcare practitioner feels dismissed. And the worst thing you can do is dismiss a patient for what they feel is doing well. When patients come here and they say, hey, Dr. Dolopo, is it okay that I'm taking my mental health medication or sciatic pain medication or nerve pain medication, their gabapentin or whatever? I tell them, you do what you got to do to feel better, because whatever you need to do out there to function well, we have enough problems going on in this world. I don't care what side of the aisle you're on. We have enough problems in this world where the last thing they need is to hear from their Western medical practitioners. Whether you're a medical doctor, usually they get more love and compassion from their nurse practitioners. But I have a lot of doctors here who are Western medical doctors here whom I love and respect because they get it and they're my patients and they're seeing results. I wouldn't care, or I would be more understanding if a person was like, oh, well, you're doing acupuncture and you just kind of feel better. No, these people are getting results. They're getting results. So don't come down on them when they're getting results and you're making them feel like crap. That's not proper bedside manners. So I discussed the multiple difficult cases that I've treated where the person graduated. I let you know why a person's case is not improving, because they're not coming in frequently. It's important to have proper bedside. I know I went off on this video, and in many videos I'm very, very kind and happy and sharing, whatever. But in this case, I'm really advocating for my patients. I want you to succeed. I want to set you up for success. And the last thing you need is from another acupuncturist or a medical doctor or some other healthcare practitioner who's saying, don't do acupuncture because it's just spa treatment. I don't understand why we're still having this discussion. I have been studying this medicine since 1994. I've been practicing professionally for the last 27 years. I don't understand why people are still closed-minded when it comes to whatever's working for the patient. Respect your patients. So my patients are watching this. They're probably cracking up right now, but I want you to know I'm on your side. I want you to be with other doctors who are on your side. And I have medical doctors that I refer to who will respect you, who understand you, and who are not going to be demeaning or derogatory when you say, I'm doing this. Okay? I'm not speaking for other chiropractors, acupuncturists, or whatever, but I'm speaking for my medicine, for me. When I say my medicine, I'm not talking about Chinese medicine. I'm talking about for me here at Elements in Harmony. So if you are a patient and you feel like you are not being heard by whatever practitioner you're with, you might want to consider moving on. There are other medical doctors out there who have gone through what you've gone through and as patients, and they're willing to extend their compassion to you. Just because you're paying with your insurance and not out of your pocket doesn't mean you're not paying them. You're paying them. That building you're paying for. My husband and I, from his work, we're paying for our insurance. We're paying for all those buildings. Dr. Tan, my late Grand Master, Dr. Richard Tefu Tan, would say, he would remind us, all those buildings, those hospitals, everything, we're paying for it with our hard-earned money. It's coming from your paycheck. And so one last thing. One of my patients is an ER nurse in a hospital, and they see 300 patients a day. Just one hospital here in Orange County. So why are we so sick as a nation? Why? I'm going to leave you with that. So, elementsinharmonyacupuncture.com. Text me at 619-341-4341. All I care about is results. All I care about is results. And if we're not getting the results here, I'm the first one who'll say, it doesn't work. I'm sorry. Let me refer you to someone else. But if you're not doing acupuncture the right way, I'm going to share with you how to do it the right way. Okay? All right. Takes care. Landline is 949-305-1703. If you'd like to get faster results or faster correspondence with me, text me at 619-341-4341. Take care. Have a great day.